Hi guys, today we are going to learn about pharmacology of Parkinson's disease. Parkinson's disease is nothing but it is a CNS disorder that affects the patient's body movement, and usually it occurs over the age 60. And the cause of the Parkinson's disease is that some of the cells in the part of midbrain are lost, which is called the substantia nigra. And usually these cells will release an hormone called as dopamine. Dopamine is a type of neurotransmitter and an hormone. It is otherwise called as happy hormone. And usually the presence of this hormone in the body will make the people happy. And the Parkinson's disease is described by James Parkinson. And usually this disease will occur over the age 60. And the patients with Parkinson's will live between 10 and 20 years after this disease has been diagnosed. As this disease gets worse with time, many people will develop the symptom dementia. And the characterization of the Parkinson's disease is tremors, muscle rigidity, difficulty in moving, and balance problems. And the symptoms of Parkinson's disease is fatigue, dementia, anxiety, depression, fragmented sleep, hallucination, and slow thinking. Some of the other symptoms of Parkinson's disease are blank facial expression, forward tilted posture, slow monotonous speech, reduced arm swinging, rigidity and tremor of extremities and head, and short and sharp. Usually, drugs for Parkinson's disease will only help to control the symptoms of Parkinson. It will not cure this disease. And two subcategories for the drugs for Parkinson's disease are initial therapy and adjuvant therapy. Initial therapy begins with one drug, anticholinergic or otherwise dopaminergic drug. Example for anticholinergic drug is levodopa. And next is adjuvant therapy, catecholomethyltransferase inhibitors. It is otherwise called as COMT inhibitors. And next is selagelin, apomorphine, and amantadine. And this is anti-Parkinsonian drugs. It is subdivided into two categories. One is drugs affecting brain dopaminergic system and other one is drugs affecting brain cholinergic system. Okay, now we are going to see about dopamine agents. And first one is levodopa. It is a prodrug and it is prepared on administration, which is nothing but usually dopamine hormone is unable to cross the blood-brain barrier, and that's the reason levodopa, which is a precursor of dopamine, has been prepared by a man. And on administering the levodopa, it crosses the blood-brain barrier and there it gets converted into dopamine. And this levodopa will replaces or mimics dopamine actions in the brain by giving more dopamine hormone. And this improves movement and restores the normal function. And second is carbidopa. It is usually given with levodopa, and the mechanism of carbidopa is that it slows down the breakdown of the drug levodopa before it reaches the CNS, so that more levodopa enters the blood-brain barrier and there more amount of the dopamine hormone gets released. And third is apomorphine. It is a self-injected agent. And the mechanism of apomorphine is that it boosts the effects of levodopa until the next dose. And the side effects of levodopa and carbidopa is that nausea, dyskinesia, that is abnormal involuntary movement of arms, legs and neck. Thank you.